Okay, this video is about migraine headache. A couple things about migraine headache, a little bit interesting. Well, first of all, basically, unilateral throbbing headache, more common in women, lasts for 4 hours, a couple of days. The old theory was initial vasoconstriction causing decreased blood flow to the brain, leading to an aura, sort of a prodrome-like symptom. Subsequently, vasodilatation causing stretching of the meninges with a throbbing headache, one side. Anyways, that theory is now sort of out of favor. The new theory in favor is something called CSD, cortical spreading depression, and it's sort of like a thunderstorm that creates initially a rim of excitation starting in the occipital lobe's visual cortex and then moving forward in the brain at about 3 millimeters per minute, and it leaves in its wake an inhibitory wave. So you might ask yourself, well, what is cortical spreading depression? And I would recommend you don't try to get in details too much, just to give you a little perspective on this. Here's a book I just finished reading called Ions in the Brain. The author's name is Samjen, and I can tell you the real details of what's happening with the ions in the brain, the potassium, the sodium, and the calcium, and the chloride at the level of the neuron. It's complicated. It's not as well understood as one would like. So I don't think it'll get you anywhere. This guy devoted his whole life to studying, the membrane ion channels and all the neurons. And he has some good insights, the way, the whole sodium gradient is coupled to everything. But I don't think it's going to benefit us to go into more of that. But just so you're aware of it. Probably if you really want to know more and more and more about the details, there's a website called Migraine Disorders where they go into more of the pathophysiology. But I really think the key point of this talk, and for a person who's got a migraine, is trying to figure out what's causing yours and learning how to avoid those things. Okay, some of the things that are interesting is that subsequent to the inhibitory wave is irritation of the meninges with activation of the trigeminal nerve, possibly a contribution of the thalamus in this whole process. But glutamate neurotransmitter, of course, it's about 80% of brain neurotransmitters, it's involved. And what do I see as an overall strategy? Just like I've talked about before, the same things that prevent dementia and that lower your neuron metabolic rate, that's all good. You want to keep your life simple. You want to avoid unnecessary stresses, unnecessary activators of your brain neurons, like those excitatory amino acid neurotransmitters, things like glutamate and aspartate, manufactured glutamate, and caffeine, stress equivalent. So MRI of the brain will usually be normal, even though migraine headaches have a really small increased risk of stroke. It's a pretty rare thing. Migraine pain, worse with movement, bright lights, photophobia, phonophobia, annoyed by sounds, hypersensitivity to touch. Patient may want to just go and, be in a dark room. MRI brain usually normal. I knew this one guy. I'm not going to say his name out loud, but he was a real famous neuroradiologist. And he was a brilliant MD, PhD guy who had done a lot of research and clinical work in brain MRI. But what I'm saying is this guy, sort of like a genius doctor, but I see him giving his lecture. He's drinking soda pop and he's fat. And he died kind of early. He died, I think, in probably his mid to early 60s. And so, there's a lot of things you can neglect. But I think you have to learn about nutrition and health if you want to have the best chance of living a long, healthy life and feeling good. So continuing on, what causes migraine? There's a lot of foods that'll do it. Fasting or skipping a meal can cause a migraine in some people. We talked about monosodium glutamate, MSG, manufactured glutamate, MFG, aspartame, associated with aspartate, the neurotransmitter. Caffeine having a major effect. Some people, it actually can be beneficial. You can get caffeine withdrawal headaches, but the smart move with caffeine is just avoid it completely. Chocolate in some people, dairy in some people, aged cheese, red wine, beer, food preservatives like the nitrates and nitrites in processed meats. You want to avoid all animal products. Nothing good will come from them. Okay, eggs, citrus fruits. Citrus fruits and corn and tomatoes are thought to be relatively new additions to the food that humans eat. And that might be why in some people they'll cause problem. Wheat, nuts, walnuts. So anyways, you can just do an elimination diet and see if that helps you. One thing at a time, see if your frequency of episodes decreases. Other things that can cause it, elevated estrogens. There's a lot of exogenous, external estrogens around the menstrual cycle can be a time that precipitates migraine episodes. Emotional stress, sleep deprivations, a stress equivalent, causing increased glutamate in the neurotransmitters of the brain, increased loss of magnesium, the vasodilator in the urine, bright lights, loud noises, bad odors, nail polish, cleaning chemicals, for example. Foods that reduce frequency of migraine, basically your whole food plant diet. It's got all the vasodilators, potassium, magnesium, fiber, and it's good. Fruits, sweet potatoes, rice are some of the other really good things. Lowering one's estrogen levels can help. So anyways, I thought that was interesting. And what do I get out of it? I don't really have a problem with migraines. I've had some people ask me about it. Is just realize all this stuff is connected. So that's why the best way to sort of just win the game of health in general is just do all the stuff that your ancestors more than 10,000 years ago could probably have done. Adam and Eve could probably have done. Eat these simple foods and avoid this modern stuff to the extent you can. Okay, I hope that helps.